Okay. Good morning, everyone. The House Subcommittee on Behavioral Health will come to order. Mr. Clerk, would you call the attendance, please?
Chair Braybeck.
I'm here.
Representatives Arbit.
Here.
Pohutsky.
Here.
Edwards.
Here.
McDonald.
Here.
Rangan.
Here.
Hertzberg. Here. Schmaltz.
Here.
Hoadley. St. Germain.
Here.
Thompson.
Here.
Madam Chair, you have 9 members present, a quorum.
Thank you so much. Representative Pohutsky moves to adopt the minutes from the June 13th meeting. Without objection, the minutes are adopted. Well, welcome, everyone. We are back in Behavioral Health Subcommittee. I'm excited to be here with everyone and with my colleagues, of course. Today, we're going to be taking up House Bills 4371 and 4372. Before we begin testimony, we have an H3 substitute to HB 5371 and an H1 sub for HB 5372 that require the state to comply fully with all federal financial requirements and allows the certification of private organizations as CCBHC demonstration sites. Representative Edwards moves to adopt substitute H3 to HB 5371. Mr. Clerk, will you please take the vote?
Chair Braybeck.
Yes.
Representatives Arbit.
Yes.
Pohutsky.
Yes.
Edwards.
Yes.
McDonald.
Yes.
Rangan.
Yes.
Hertzberg.
Yes.
Schmaltz.
Yes.
St. Germain.
Yes.
Thompson.
Yes.
The motion to adopt. The motion prevails.
Thank you so much, Mr. Clerk. Representative McDonald moves to adopt substitute H1 to HB 5372. Mr. Clerk, if you would.
Representatives Braybeck.
Yes.
Arbit.
Yes.
Pohutsky.
Yes.
Edwards.
Yes.
McDonald.
Yes.
Rangan.
Yes.
Hertzberg. Yes. Schmaltz.
Yes.
St. Germain.
Yes.
Thompson.
Yes.
Madam Chair, the motion prevails.
Thank you so much, Mr. Clerk. The House Subcommittee will go at ease.
The House Policy Subcommittee on Behavioral Health will now come to order. We will now hear testimony on House Bills 5371 by Representative Braybeck and 5372 by Representative Green.
Thank you so much, Mr. Chair. We appreciate being here, and I'm happy to keep working on mental health legislation with our colleague. So we have talked for a long time in this committee about CCBHCs, and I'm excited that our bills are finally before you. As you know, Michigan is in the federal CCBHC demonstration program and has been since 2020. That program has been extended to 2026 through the Bipartisan Safer Communities Act. However, with the federal demonstration nearing its end, it's essential to codify the CCBHC language into our state law to protect these long-term services that are so necessary. So I'm going to talk about my bill. Representative Green will talk about his. What my bill does is it requires DHHS to establish a prospective payment system so that we can sustainably fund our CCBHCs. So it ensures consistent advance funding that aligns with the federal methodologies. It also sets a deadline for implementation by January 1, 2028 to avoid disruption of our CCBHCs. It also requires HHS to certify our CCBHCs based on the federal criteria. Here's why these bills are essential. CCBHCs provide 24/7 access to crisis care, addressing our most urgent need in a much more comprehensive setting. These bills also secure CCBHC's ability to serve all Michiganders. If you recall, CCBHCs, it doesn't matter what's going on for you, your acuity or your insurance. So that is a huge difference in terms of service provision around mental health care emergencies. The prospective payment system that's in my bill is crucial for our CCBHCs to operate predictably and to avoid any funding gaps. And the sustainable funding allows us to focus on being able to provide that continuous care that is so important in addressing our mental health care crisis. CCBHCs, as you know, offer an integrated model of care that combine mental health, physical health, social services, all under one roof. And this model reduces wait times, which we've seen. It keeps patients out of emergency rooms, and it helps avoid hospitalizations, which is exactly what we want. Michigan would join other states that have already committed to CCBHCs as a permanent solution, aligning with a system that is both proven and federally backed. This is not, though, just about following our federal guidelines. It's about making Michigan, our state, a leader in addressing behavioral health and making the state a supportive environment for all of our residents. So as a clinical psychologist, I have seen firsthand the importance of accessibility and integrated healthcare. And by passing both of our bills, Michigan can then cement CCBHCs as a permanent resource and a stable foundation for our mental health services for our residents. And I thank you for your consideration of this vital legislation.
Thank you, Mr. Chair, and thank you, members of the committee, for taking up this piece of legislation. Over the course of many years, and actually, thank you, Chair Braybeck, 2 chairs today, for your work on this topic. My time in the legislature has been sort of the signature of that has been in the working in the mental health world, and being able to take a very small community, but on the flip side is a very important issue and very important topic to each of our communities, and then realizing that we don't work in a vacuum. And so when the CCBHC models, as well as the programs were developed on the feds, they became sort of a pass-through. That it's a federal program, but then there's a state requirement. And so we wanted to make sure that it was as easy as possible to be able to implement these federal programs. And one of those ways was looking at the regulatory program of it. And so as we discussed how do we promote this, one of the things was let's just make it easy as possible for those who want to enter into this world to only have one set of rules to follow. And that is the impetus of 5372 that says this is a federal program. Our rules will align with the feds on how to implement and how to run these programs. So very simple bill, just simply says that the state's requirements can be no greater than what the feds require.
Mr. Chair, may I add one thing? We wanted you all to know that we've been working with our department, HHS, on these bills. They've been a great partner in this. There are a couple of things that we're going to be continuing to look at, but we will continue to work on those with the department and are really grateful for their support and partnership with this.
Do we have any questions for the members? Representative Ryan Gans.
Thank you, Chair Braybeck, for the change in the sub to allow for any sort of waiver authority to be used for securing the prospective payment system. Thank you.
Any other questions? Okay.
All right. The House Subcommittee on Behavioral Health will come back to order. We are now going to hear further testimony on HB 5371 and 5372. Here to join us via Zoom are Lisa Williams, who is the CEO of West Michigan Community Mental Health, and Trish Cortez, the Executive Director of Washtenaw County Community Mental Health.
Good morning, and
Good morning.
thank you for having us today. I think that I really want to applaud and thank both representatives for bringing these very important bills forward. I can talk a little bit from Washtenaw County's experience, kind of boots on the ground, is that CCBHC has truly transformed our mental health system and has really transformed the way that we approach mental health here in Washtenaw County. The truth is I've been here at CMH for almost 25 years, and for the better part of like 2 decades of my career here, there's always been this a little underlying tension with the community and the community mental health system. And the reason behind that is because we limited access to a much broader array of service to a very small subpopulation. You had to have Medicaid and you had to have a certain level of acuity, which left a lot of people out. Now, in our community, CCBHCs, because we are allowed to not say no, and that we can say yes, it has changed our partnerships in the community exponentially. So our partnerships with our courts, with our law enforcement, with our safety net primary care providers, our schools, and the list goes on, is absolutely has been transformed. And those partnerships are absolutely stronger than they ever have been. And we are collectively as a community really changing the landscape around mental health services in Washington County. I'll give you just quick numbers. And after the first year of implementing, full year of implementing CCBHC, we saw an increase 104% of children being seen here in Washington County. That was 147 increase for adults in Washington County. We historically never served the mild to moderate population. In that first year, we served over 2,000 individuals with mild to moderate conditions. Calls for service, we used to average around 4,500 a month. We are now at about 10,000. So you can really see that access to to care has absolutely changed dramatically. The other data point is that, whereas before we served under less than 50 individuals that didn't have a form of Medicaid, in that first year, we served around 12,000. So 1,200, sorry. So as you can see, it has really changed what we do here in Washington County. It has been absolutely transformational and has really benefited the residents of Washington County. So I thank you for bringing these bills forward and considering them.
Good morning, and also thank you to the subcommittee for consideration of these bills and to Representative Brightback for bringing these bills forward. My name is Lisa Williams. I am the Chief Executive Officer at West Michigan Community Mental Health. We cover Mason, Lake, and Oceana counties over on the west side of the state. All three of our counties are rural, and similar to Tricia's experience, being a CCBHC has fundamentally changed the way our organization operates and our ability to serve and meet the needs of our very rural communities. I'm also going to speak, we have similar kinds of data, although our numbers are a little bit smaller because we're rural communities. But I'm going to share some data from some statewide information that we've collected through our collaboration with our CMH association. Statewide, just since CCBHCs in Michigan, and there are now 35 CCBHCs in the state that are certified through the state demonstration. 37% increase in the number of individuals served since CCBHC demonstration began. 95% of the CCBHCs offer same-day access, and almost all the CCBHCs have expanded their crisis services. There's been a 120% increase in access for folks in that mild to moderate level of care. This is tremendous because that access for those individuals with mild to moderate services was extremely limited, and particularly in rural communities, we saw this. Additionally, there has been a 128% increase in access to medication-assisted treatment. As you all know, in the midst of an opiate crisis, access to medication-assisted treatment is our most effective way to ensure recovery is possible and to save lives over time. So this is tremendous access. All of these are vehicles that allow us to strengthen our community safety net, our partnerships with law enforcement, our partnerships with our court systems, our partnerships with our schools, our partnerships with homeless shelters. All of those things create opportunities for us to provide services to folks with all kinds of mental health needs, regardless of their insurance, and to ensure that folks get those needs met prior to requiring intensive crisis or intensive hospitalization types of services. So we are strongly in support of House Bills 5371 and 5372 and making CCBHC a permanent structure for integrated healthcare delivery in the system in Michigan. Thank you.
Thank you both so much, not only for being here today, but for coming before us on several occasions to really help us understand both what CCBHCs do and their impact. We're grateful. So now I'm going to read in, we have a couple of cards, no one wishing to speak, but both supporting the Michigan Care Council and the Michigan Association of Substance Addiction Providers. We're now going to have a vote to refer House Bill 5371 to the Health Policy Committee. Rep. Reingens moves to refer House Bill 5371 to the Health Policy Committee. Mr. Clerk, if you would call the roll.
Chair Brayback?
Yes.
Representatives Arvitt,
Yes.
Pohutsky,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Rangan,
Yes.
Hertzberg,
Yes.
Schmaltz,
Yes.
Hoadley, St. Germain,
Yes.
Thompson.
Yes.
Madam Chair, you have 7 yeas, 0 nays, 3 pass. The motion prevails.
Thank you so much. Rep. Herzberg moves to refer House Bill 5372 to the Health Policy Committee. Mr. Clerk, will you call the roll?
Yes. Chair Brayback?
Yes.
Representatives Arvitt,
Yes.
Pohutsky,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Rangan,
Yes.
Hertzberg,
Yes.
Schmaltz,
Yes.
Hoadley, St. Germain,
Yes.
Thompson.
Yes.
Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
Thank you so much. I really appreciate it. Thank you, colleagues. Next, we're going to be taking up House Bill 5785, which grants limited licensed psychologists the ability to practice without lifelong supervision. The House Subcommittee will go at ease.
The House Subcommittee on Behavioral Health will come to order. We will now hear testimony on House Bills 5785. Here to testify in support of the package is Representative Brayback.
Thank you again, Chair. Thanks, colleagues. Again, we have spoken in this committee about the issues to access and the mental health care workforce. This bill addresses both. So what this bill does is it aims to strengthen our mental health system by updating the Board of Psychology and empowering more psychologists to practice independently. Currently, what happens is if you have a limited license as a psychologist, which means a master's level degree, you're required by law to work under continual supervision for your entire career. This supervision requirement is super burdensome because that means that someone who has been practicing, for instance, for 30 years needs to continue to have that supervision. It is unlike any other master's level mental health care profession that we have. So it allows our master's level psychologists to practice without that constant supervision, and this does not impact what folks have to do to be able to get that. Like, folks still have to go to an accredited institution. They will have to have 4,000 hours of supervised experience, which is in line with many of our other master's level mental health care professions. So this allows our master's level, sorry, I keep wanting to say social work, 'cause I'm so used to saying that, psychologists to practice more independently. That means that there are shorter wait times for our neighbors, and then they have that access to that ongoing care. And we're just removing this barrier that has been in place for a very long time, and we know that we have a rising demand. I mean, you just heard what CCBHCs have been able to do with the increase in access. This will also help in that. I also want to add that this is a bill that has been worked on for over 3 decades. And so we are finally here today with a solution to provide to you. I'm very excited to be able to be a part of it and to be stand with other mental health care providers in offering this what very common sense solution to this issue. Mr. Chair, I'm happy to take questions if there are any.
Any questions from the committee? Okay.
It's super straightforward. Thank you. All right, the subcommittee is back in order. We have now Mary Clark, who is with us, as well as Teresa. Teresa, I don't want to mispronounce your name. Gosicki, who is also here with us. Please come on up, and we're excited to hear from you.
Good morning. My name is Teresa Gosicki, and I'm a limited licensed psychologist here in Michigan. I earned my master's degree in psychology in 2014 and have been licensed as a master's level psychologist for the past 10 years. I'm extremely passionate about psychology and my work as a psychotherapist, but at one point, I almost left the mental health field entirely due to the hardships I've faced as due to the LLP license. In fact, many of my former classmates have left the profession, which is truly a shame because of the demand being so high for mental health professionals these days. I chose to earn my master's degree in psychology because of the curriculum. The program I completed was 60 credits. It required completion in courses such as professional ethics, psychotherapy, psychopathology, psychological assessment, and 2 experiential practicums. I knew that earning this degree I would be very well prepared to work as a clinician in the mental health field. What I did not know, however, is how much hardship I would face when trying to serve Michigan residents as a mental health professional. Not because there was a shortage of need in the mental health field and not because of a lack of skill on my part, but simply because of the career-long supervision requirement for my LLP license, which would lead to discrimination from insurance companies, professional certification programs, and employers alike. In fact, I once had a prospective employer say to me, "I really like you and would hire you, but I just hate your license." He then encouraged me to return to school to earn another 60-credit master's degree in social work because he knew that social workers could practice independently. The qualifications of LLPs in Michigan are on par with that of other master's level mental health professionals such as social workers and counselors, yet there remains this major discrepancy when it comes to independent practice. And it's a discrepancy that restricts 4,000 Michigan LLPs from fully meeting the needs of the public as independent mental health practitioners, able to practice within the scope of our education, training, and competencies. I thank you all for your willingness to listen and to consider making this crucial change that has the potential to improve the lives of so many.
Good morning. Excuse my allergies today. My name is Mary Clark. I have a doctorate in counseling psychology, but I have practiced as a limited licensed psychologist for 40 years. I got it when I was 10. Okay. But this is my story. Until the spring of 1979, a person could obtain a full licensed psychology with a PhD in psychology or equivalent education. But then in the spring of 1979, the Board of Psychology changed it to only allow the PhD for a full license and not allow the equivalent education. Those not qualifying for the LP were offered the LLP with the requirement that they be supervised forever. In December of '79, if you follow the dates, I graduated with equivalent education. So I no longer qualified for the full license. I've had to practice as a limited licensed psychologist ever since. Over the past 40 years, I've been required to have supervision every month. Over the past 40 years, I've had to turn patient referrals away because their insurance will only pay independent providers. Supervision means you are not independent. Over the past 40 years, I wanted to devote part of my practice to low-income people, but Medicaid only pays independent providers. Over the past 40 years, some of my patients who eventually qualified for Medicare could not be seen by me anymore because Medicare won't pay me. They had to start over with someone else. Over the past 40 years, I have seen MSWs and LPCs and LMFTs obtain independent practice licenses and have job opportunities for which I was denied strictly because I was not independent, while being told I was completely qualified. The eternal supervision requirement has created an unfair playing field for me since 1979. Granting LLPs independent practice will not compete with any other mental health providers because there is so much need and there are so many unfilled jobs. During 2023, the Michigan Psychological Association Masters Committee, on which we both serve, researched information on the issues of need, denial of payment and certifications, and over 100 job postings that were independent only. I have 2 binders with the results of all that research, and if anybody would like to have one, I'd be happy to give it to you. Granting independent practice to LLPs will help resolve the mental health access problem at no cost to the state of Michigan. I have been involved in the effort to gain independent practice since 1990. And I am grateful for your help today, and I look forward to it finally happening. Thank you for taking the time to understand the importance of HB 5785 to me and to 4,000 LLPs in Michigan. Thank you.
Thank you both so much. Colleagues, any questions? Okay, thank you. We appreciate it. We now have several cards to read in. None wishing to speak, all in support. Monica Martinez from the Michigan School of Psychology. We have Alan Bolter for the CMH Association of Michigan. Alan Kate from Michigan Psychological Association. Gabe Basso from Blue Cross Blue Shield of Michigan. Michigan Behavioral Health Wellness Collaborative. Michigan Association of Substance Addiction Providers, and Michigan Care Council. Additionally, colleagues, the clerk had around 930 additional cards of support sent to them. Obviously, we're not going to read all of those in, but they will be on record through the clerk's office. So clearly, this is an issue that has a lot of support and deserves our attention. We will have a vote to refer House Bill 5785 to the Health Policy Committee. Rep. Arbit moves to refer House Bill 57. Oh, yes, I'm sorry, I didn't have that part. I'm so sorry. Do I need to undo that somehow? No. Okay. Oh, can we go to these? We're going to go to these for a second. All right, everyone, we're back. Rep. Pudsky moves to adopt the H1 substitute for House Bill 5785. Mr. Clerk.
Chair Brayback.
Yes.
Representatives Arbit,
Yes.
Pawlicki,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Reingans,
Yes.
Hertzberg,
Yes.
Schmaltz,
Yes.
Hoadley, St. Germain,
Yes.
Thompson.
Yes.
Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Mr. Clerk. Now Rep. Arbit moves to refer House Bill 5785 to the Health Policy Committee. Mr. Clerk, if you would.
Chair Brayback?
Yes.
Representatives Arbit?
Yes.
Bohutsky?
Yes.
Edwards?
Yes.
McDonald?
Yes.
Rangan?
Yes.
Hertzberg?
Yes.
Schmaltz?
Pass.
Hoadley? St. Germain?
Pass.
Thompson?
Pass.
Madam Chair, you have 7 yeas, 0 nays, 3 pass. The motion prevails.
Thank you so much, Mr. Clerk. Colleagues, thank you so much. The bills that we've passed today will make a huge difference in our residents' lives. I will be excited to present them to Health Policy as soon as Chair Rogers allows, but I thank you for your partnership on that. And with there being no further business. Oh, I have absent members. Sorry. Let's have Rep. Edwards moves to excuse all absent members. And there being no further business before the committee is adjourned. Thanks, everybody.